just going to talk briefly about attention, because it turns out that attention probably is not a thing. It's kind of like the orchestra conductor. And by the way, do you know how attention deficit disorder is diagnosed? People ask me, you know, do you do an ADD test? The way that the ADD is diagnosed is really by counting symptoms. If you look at the diagnostic criteria for attention deficit, there are 9 symptoms that are connected with what's called inattention, and 9 symptoms that are connected with impulsivity and hyperactivity. And essentially the Conners scales or the Vanderbilt scales or any of the tools that are out there are basically looking and saying, do you have 6 of 9 of either of these symptoms? And if you do, then and it's affecting your academic performance, and it began before 6, then you have ADD, which misses the fact that people can have attention difficulties and not have all those symptoms, or people can have all those symptoms and not have attention difficulties. You know, when I started medical school, I think what they taught us was something called differential diagnosis, which means that when somebody has symptoms, you're supposed to figure out what's causing those symptoms. You're not just supposed to count those symptoms. So it kind of reminds me about the fact that you know, a common scenario will happen where a teacher might call a parent and say, and you know, just to caution you, because it's well meant, but they'll say, you know, Tommy can't sit still in class, and I think he might have ADD, because he reminds me of Johnny last year, who had ADD and he responded to stimulant medication. And I prescribe stimulant medication. I'm not saying that I don't, but I'm saying, you know, it's interesting because a teacher would never think of saying, Tommy's running to the bathroom every 5 minutes, and it reminds me of Johnny from last year who had diabetes. I think he's got diabetes. So, you know, I think that, and I think doctors fall into the trap. So it's not your fault. But when the parents say that and the doctor hands out a checklist and say, we're going to test him for ADD, and I say, well, wait a second. Just because the teacher thinks it might be diabetes, I'm not going to say, does he have diabetes or not? I'm going to say, why is he running to the bathroom every 5 minutes? And so the question I need to answer is, why can't he sit still? One of the causes could be ADD. Could be something else. I once put a stethoscope on a kid's chest who couldn't sit still, and he was wheezing. He had undiagnosed asthma. Well, it's hard to sit still when you're having difficulty breathing. So that the point is that I think we have to move beyond symptoms, and also if we're going to look at attention, we need to know that attention had different pieces to it. And so even if somebody has attention deficit, it becomes important to know whether or not they don't have enough energy to focus, whether or not they're distracted, or whether they're impulsive, because what we need to do for those kids is going to be different depending on what symptoms they're manifesting.